So Schuyler Hospital was awarded a transformation grant in 2018. In 2019, construction started, and on April 21st of this year, we are very proud to complete phase 1 of the transformation grant. Phase 1 is the completion of our new med-surg unit. The previous med-surg unit really had remained pretty much untouched since 1972. The fact that we can now provide state-of-the-art services with documentation at the bedside, having different zones to care for the patient, the ability for patients to stay in the room with their loved ones comfortably is going to be huge for visitors and for the family members and for healing into the future. We are really excited to step forward into the 21st century and be able to provide all the services that anyone else in our region can provide.
We've tried to bring as much of nature into our environment as we could. When we set out to design it, the design concept that we used was actually a journey through the gorge. As you come into the unit, you get a sense of nature with green soffits and green ceilings that help it feel like you're in a tree-lined canopy. We used a lot of natural light. As many windows as we could get in there, natural light is a healing element. If anyone was ever in our old unit, those elements of the healing environment and person-centered care were not part of the designs in the 70s. It was all about institutional design. And here we are designing a program around the patient, around the ideas of bringing those natural elements into the care environment.
The design of actually the patient rooms was very exciting for all of us. The design team put together a plan and then brought it in and actually built a patient room on the floor that we could walk in, we could work in it, we could position all of the furniture. The staff was able to kind of see what it would feel like to work at the little workstations we have with the computer, where we planned where our communication board was going to go, where our closet was going to go, where our hand washing sinks and so on. Everything was planned for the convenience of the staff and efficient workflow and for the comfort of the patient and the family.
We are excited to continue this journey as phase 2 of the project is now underway. This phase is transforming the old medical surgical unit into a new modern primary care clinic. So this is a really big year for Schuyler Hospital. The 100th anniversary is definitely a landmark year for Schuyler Hospital, and we are really excited to continue to change and grow throughout this year and into the future. And we're looking beyond, today and looking towards the next 100 years. Welcome everyone. Today we are proud to announce the completion of our nearly $11 million transformation grant project at Schuyler Hospital. The project resulted in a brand new medical surgical unit that we opened last April, and today a state-of-the-art primary care center. This marks a complete renovation of almost the entire facility since 2014. It's a new Schuyler Hospital and a new day for our community. Today, when our community comes for primary care or convenient care walk-in services, we can offer same-day scheduling of lab work and most imaging services. Not only does this grand opening provide convenience to our community, but it also provides improved care as our providers can work more closely with our specialists from Cayuga Medical Associates, ensuring continuity of care and improved outcomes. The design of this space includes natural light and nature themes intended to provide a calming and healing environment. Our new location boasts more spacious exam rooms, which are telehealth enabled, as well as a designated space for a partnership with behavioral health. We look forward to welcoming our community to a new day of caring at Schuyler Hospital. And now I'd like to bring forward Matt Roof, Project Manager, Matt Taylor, Facilities Engineer, and Ben Sachs, Physician Leader, to cut the ribbon.
Okay. All right. You ready? All right, guys. On 3, everyone. Ready? 1,
2, 3. Awesome.
Hello and welcome to the new primary care center at Schuyler Hospital. I'm Matthew Roof, the project manager for this project. I'm looking forward to giving you a tour today through our new facility. The first thing you'll notice when you enter our new primary care facility is a beautiful wide open waiting room with views of the Montour Falls Valley. We also have a newly designed registration area where people who come for any form of outpatient care, whether that's for primary care, our convenient care center, or the specialty clinic, will register and be taken care of by our staff. Our entire facility has been designed to bring nature into the care environment, so you'll note local photography on the wall highlighting our beautiful surroundings. Now I'll take you to one of our exam rooms which have been designed around the patient. Each exam room is equipped to take care of all kinds of patient needs, whether that's a primary care visit or a convenient care visit. You'll notice all throughout our facility that the space is much larger. Each exam room is approximately 50% larger than our previous exam rooms. The facility was designed for optimal patient flow. We've added 20 total exam rooms. The facility is designed with 3 central corridors and then a corridor that cuts across those where staff and doctors can interact with each other surrounding each patient for their care. One of the major features of our new facility is a new, improved, and larger point-of-care laboratory. When patients come in and they need to have a basic test such as a flu or a strep test, they'll be able to get that and get their results instantaneously here in our facility. In addition to a much larger space, we've added some new technology. This is the latest state-of-the-art laboratory equipment that allows for accurate and timely results. As we designed the facility, we considered elements that could add additional privacy and dignity for our patients. For instance, a common test is for someone to have a urine screening. The pass-through window in our laboratory allows patients to provide their samples to our staff in a touchless manner. At the conclusion of your visit, the provider will escort you to the discharge area where our staff will help to arrange for things like referrals to specialists, laboratory, or imaging orders. If your doctor does order a laboratory or imaging visit, that can be accomplished right here on the same floor of the hospital. Our community has been coming to our primary care center since 1978. Moving the primary care center into the main hospital allows us to continue our tradition of providing excellent access to high quality care, but just in a new, brighter, open space that will only serve to improve the quality of care and the access for people.
Hi, I'm Dr. Gregory Ripich. I work here at Cayuga Medical Center. I'm a general surgeon. I specialize in robotic surgery. I do a lot of hernia repairs. Cayuga Medical Center is now offering robotic surgery with 4 surgeons that are performing robotic surgery for general surgery. We're doing bariatric surgery. We're doing gynecologic surgery with 2 separate gynecologic surgeons, and there's more to come. It's been an incredible year for us. The advantages of the robotic surgery are things such as better visualization, 3-dimensional visualization, which is improved over our laparoscopic or minimally invasive surgery, as well as incredible instrumentation. These instruments have more movements than the human hand, so very fine, precise, precision instrumentation and great visualization. And these things help us with faster recovery, less bleeding, better outcomes.
With Cayuga Health's highly skilled team, advanced resources, and nurturing environment, there's no need to go anywhere else.
This concept may really help patients in a wide radius. One advantage to patients is that Cortland is in an essential area geographically, because if one runs into a problem with an injury or one has an orthopedic problem, they have the conundrum of, what do I do next? Do I call my primary care doctor, try to get a referral to one of the centers, and then they're going to maybe give you an appointment in 2 to 3 weeks? And what we can provide is immediate care that's at the highest level of orthopedics to these places. Not only most things being able to be taken care of right here in Cortland, but direct access to even more higher subspecialty care right in the vicinity. The idea is that you can come right in and be seen and get that care you need.
Cayuga Medical Center provides state-of-the-art care to patients diagnosed with chronic diseases. 10 years ago, Cayuga Medical Center began focusing on improving the health and well-being of its community through prevention, thus developing the services within the Cayuga Wellness Center as a resource to help prevent potential illness by maintaining and improving health. The Cayuga Wellness Center contains 5 different programs that all contribute to helping people live a healthier lifestyle. Raza Spa the only full-service holistic health spa actively cultivating wellness in the Finger Lakes region, offers an extensive range of natural healing therapies and treatments, from skincare to massage to meditation. Raza is the perfect synthesis of quality service and deep respect for natural healing. The Cayuga Center for Healthy Living offers innovative medically based programs for those looking to lose weight, quit tobacco, eat better, lessen stress, begin exercise, or manage living with a chronic health condition. They will assist you in making lifestyle changes that can prevent, delay, or lessen chronic disease. The Cayuga Medical Center is the area's leader in comprehensive physical therapy services. It is staffed by an experienced team of specialists with professional certifications in a multitude of areas that are unmatched in the Finger Lakes region. Cayuga Medical Center's physical therapy department provides care to patients of all ages, from orthopedics to sports medicine and neurologic rehabilitation, pediatrics, occupational and speech therapy, and much more. For those seeking premier fitness and wellness programs, Island Health and Fitness features both top-of-the-line equipment and experienced and friendly staff dedicated to helping people meet their fitness goals. Group classes and personal trainers are available to members age 14 and up at any skill level. Finally, the Cayuga Medical Center's Sports Medicine and Athletic Performance Program provides medical care from physicians who are experts in musculoskeletal and medical sports-related conditions. Their varied services include assessment and treatment of shortness of breath in athletes and acute and overuse injuries such as strains, sprains, joint pain, tendinitis, and stress fractures. From performance testing to injury assessment and treatment, the Sports Medicine Program is built on clinical services tailored to all types of athletes. At Cayuga Wellness Center, you may be rehabilitating from an injury, gearing up for an athletic event, hoping for a relaxing escape via massage, or continuing medical or nutritional counseling on a path to a healthier lifestyle. Whatever your challenges, concerns, or goals, the Cayuga Wellness Center is the Finger Lakes' #1 resource for fitness and wellness.
This is exciting for us. We've been in the community for at least 3 years now and seeing patients just in clinic, but we haven't been doing cancer treatments up in Cortland. And that's a commitment that we made over 1.5 years ago, and it's finally come to fruition. So it's a brand new space. It's designated for oncology and designed specifically for our oncology patients. And it's going to allow us to not only see patients in clinic, but administer treatments such as chemotherapy, iron or immune therapy right here in the Cortland community. We have an office by the Tompkins-Cortland Airport over on Warren Road, and we had patients who were traveling there for treatment. But that's still a 25-minute, 30-minute drive, and this will allow us to give patients treatments more frequently and more conveniently. So I think what's really kind of special about this space is the size of the office and the way that it's designed to bring the providers and the patients together. We have chemotherapy chairs, which is in this very kind of beautiful open space with these huge floor-to-ceiling windows, which is a nice place to be. And then as the provider, we're right here, a few feet away, and seeing patients in the offices right next to this. So it creates a great sense of community. It's a great format for communication and allows us to kind of always know what's going on with our patients and making sure they know that we're here for them.
Hi, I'm Eric Jansen, the Director of Behavioral Services at Cayuga Medical Center. For the last several years, Cayuga Medical Center has created a plan to upgrade our behavioral health inpatient facilities. Then, in the fall of 2017, construction began on the project that would add more than 6,000 square feet of space dedicated to enhanced patient care and to fully renovate all of the remaining space in our behavioral services unit. The plan included moving to an open concept with increased natural light and improved spaces for individualized one-on-one care and wellness. Patient rooms were renovated and constructed with first-class materials including ceramic tile, calming colors, premium fixtures, large windows to allow for more natural light, and improved safety. Offices and meeting spaces were constructed on the unit to allow patients improved access to their care team and to improve team communication. New space for treatment team meetings, as well as space for group psychotherapy, family and team meetings was also added. In future construction phases, smaller consultation rooms allowing for more individual privacy for examination or consultation will be added. Common space is one of the most important and exciting aspects of the new construction, since patients on the Behavioral Health Service unit are encouraged to be out of their rooms and to participate in various unit activities. The addition of improved common areas most directly impacts patient care. One of the major accomplishments of the new space construction is the milieu area, which includes 3 separate areas: the porch, the television or sitting area, and the dining and recreation area. We've incorporated this open-air concept into other sitting areas in the milieu by providing areas with large windows with sweeping views of Cayuga Lake and the surrounding valley in order to provide an opportunity for patients to have more private conversations and to be able to relax in quiet contemplation. The space is also constructed so that sound is absorbed, allowing multiple groups or conversations to go on at the same time without disrupting other groups. We've also added technology to this space that includes the addition of Apple TV to deliver cinema therapy and to support learning activities for patients on the unit. With the new technology, we can deliver a broader range of programming targeted to our patients' needs. We can also provide music or relaxing sounds through the speakers integrated into the ceiling, thus creating a calming, welcoming, and therapeutic environment. Another feature of our construction and the renovation is the inclusion of open concept nursing stations. One station is located in the milieu space and the other station is closer to the dormitory area. Each station has half-height walls that encourage patients to approach to have their needs met and encourages staff to be more available to patients to help meet their needs. The wellness room is an innovation. It is space designed to promote wellness through exercise, relaxation, and comfort. It provides an additional area for programming like yoga, relaxation, and guided visual imagery or stress reduction. This space is available 24 hours a day and can be used by an individual and allow for privacy while being monitored by staff. The quiet comfort room is adjacent to the main nurse's station and incorporates floor-to-ceiling windows that allow an abundance of natural light. It is configured to provide an opportunity to enhance one-to-one conversations or small family meetings in a relaxed and comfortable atmosphere.
With compassion, courage, and competence, Cayuga Health is confronting the threat coronavirus poses to our local communities with a direct head-on response. To address the need for safer regular health care, Cayuga Health rapidly expanded telehealth services and capabilities to allow patients to stay home and have online appointments with their doctors. Telehealth is now offered by over 200 providers within the Cayuga Health system.
We began using the Rheonics analyzers for COVID-19 tests in May of 2020. Before we had the Rheonics, NVX, and Compass analyzers in-house, we had to send out our COVID-19 tests to a reference laboratory, and that meant that our turnaround times were 2, sometimes 3 weeks or even longer. Right now, we can process tests in same or next day. We started with 2 analyzers back in May, and we've slowly been building our inventory of analyzers. Right now we have 9, and our goal is to get up to 45. That's a big operation, but by growing that, we hope that we'll be able to continue to deliver high-quality testing to the region and be able to keep people healthy. It's been absolutely, instrumentally changing for us. We've really tried to become a center to be able to process and test for COVID-19 in our region. We want to be able to take care of our community and keep our population healthy and our employers open, our schools open. It's really important to us to be able to contribute to the community in that way. And by building up our ability to perform COVID-19 testing, we've been able to do that. Each analyzer allows us to process around 400 tests per day with our pooling process. We've been working closely with Rheonics as a partner to be able to expand the resource and the testing capacity through using pooling technology. We've internally validated pooling methods both for saliva and for upper respiratory specimens. And we pool 5 specimens per test, which has greatly allowed us to extend the resource and the testing capacity. The FDA EUA is for upper respiratory specimens. It's for nasopharyngeal, anterior nair, bronchial washings, things like that. And we have additionally validated internally for saliva. It's pretty phenomenal when you think that we're just a community hospital laboratory, but we would absolutely not have been able to do this without Rheonics. We actually have 3 other types of analyzers in our laboratory that are capable of performing COVID-19 testing that we use for other diseases. To this date, we've not been able to get enough reagents or any reagents for any of those analyzers to be able to perform testing. Only on October 1st were we able to get a limited supply from one of those manufacturers. If we had not had Reonics, we would not have been able to perform hundreds of thousands of tests. It's pretty remarkable. You know, when we started, our focus was on serving our community, but because we were able to, with Reonics' help, build our testing supply capacity, we were able to rapidly expand how many tests could reach people. And so we've been able to offer testing across the state to nursing homes, schools, employers, basically anybody who needs testing to be able to stay open, stay healthy.
Cayuga Health Giving Day is something new for Cayuga Medical Center as well as Schuyler Hospital. We had to make the difficult, though correct, decision to cancel both the Cayuga Medical Center Foundation Gala and Schuyler Hospital's November Splendor. So we needed to come up with an alternative plan. It's an opportunity, yes, to raise funds and for the community to be part of that, but also an opportunity to celebrate the work that our healthcare heroes have done here, both in Tompkins County, in Schuyler County, and really throughout the region. When the COVID-19 crisis really hit Tompkins County, we had the honor of being the recipients of an overwhelming level of support from the community, whether it's donating PPE or food for our frontline healthcare heroes, on down to tablets that allowed us to provide opportunities for patients to communicate with their friends and family. We received thank you notes from members of the community, school children as well as adults. We had kids who decided to do their own fundraisers and donate the money to the foundation. So it was really touching and as I said, overwhelming. It's not what the foundation has traditionally done, but it was a really rewarding experience to be able to contribute to the effort that way. If someone was considering making a gift to either the Cayuga Medical Center Foundation or the Schuyler Health Foundation, I would tell them that what they're doing is they're investing in their community by ensuring that there is a strong community hospital that is available to them and their family should they need it.